the girls in the practice that I was locuming at, were talking about this new GV20 injection site. And I was like, what the hell is that? Thinking it's some like weird viral trend that people are doing. But actually, people are doing it and it seems to really work. I find it weird. So if you haven't heard about it, it's this apparent GV20 injection site, which is on top of the head, which you're supposed to say that you can do vaccination, sedation, all this sort of stuff in it. And it's called the Governing Vessel 20 acupuncture location. They say that it's located on the dorsal midline of the skull, just caudal to the point where the imaginary lines from the rostral ear bases meet. So it's sort of like the top of the forehead, if you want to call it that, or like the back of the head. But apparently, dogs and cats seem to tolerate it really, really well. And apparently as well, if you give sedation subcut in that area, apparently it's similar to, but more consistent than IM injection. So potentially they're sometimes saying that it could work better than your IMs, but maybe that's because there's not really as much fat on top of the head. So in your really chunky patients and you've just injected intra fat rather than IM because they're so chunky, maybe that's why. But yeah, I just thought it was really interesting. And they said
So
that
subcut at the top of the head or into the muscle?
subcut.
Sorry, you said
No,
subcut. Yeah, okay.
Yeah, subcut at the top of the
I'll
head.
try
And
it.
they say apparently they looked at site temperature or something like that in between there and muscle, and they said that apparently it's got greater perfusion in that GV20 site, because apparently they say that it does better sedation but with less nausea and vomiting. And they say that maybe that's why, because it's got better perfusion. I don't know, but it just seems a little bit weird. So if anybody is routinely doing it, then let us know, because I just think it's really interesting. It's like a completely new way to jab them. But I don't know how owners would perceive it if I'm just like, oh, I'm just going to lift up the skin on its head. Then it's going to look like you're injecting its brain or something. They're going to be like, what are you doing? So especially in a cat, I find it really weird, but I don't know.
Yeah. I like this though. No, I'm definitely going to give this a go. I was all ready to poo-poo it. And